Assalamu alaikum. I am Dr. Pervin Akter, Professor and Head, Department of Physiology, Bashundhara Ad-din Medical College. Today I am going to conduct my lecture on blood group and transfusion. So let's start. What do you mean by blood group? Blood group is the grouping of blood according to presence or absence of specific genetically determined antigen on the RBC membrane. Why you do the blood group? Blood group is doing to know the blood group of individual. Clinically it is used to do the blood transfusion. Medically it is done to do the paternity test, and it is also do the for the genetic interest. Blood of different people have different antigenic and immunoproperties. RBC membrane contain a variety of antigen. On the basis of presence or absence of antigen, blood is divided into various type or group. Mainly the OAB system, RS system and MN system. What do you mean by antigen or agglutinogen? Antigen is a polysaccharide present on the RBC membrane. It is a chemical compound that are different from all other compounds against which the antibody develop. Other than the RBC membrane, it is found on the pancreas, lung, liver, kidney, saliva, semen and amniotic fluid. It is appear on the 6th week of intrauterine life. At birth, it is 1/5 of the adult life, and it is appear on the peak at adolescence. And what do you mean by antibodies? Antibodies are gamma globulin present in the plasma, produced in response to antigen which it is acts specifically. It is appear in the 10 days of the intrauterine life, and it rises in the peak level at 10 years, and then it is decline. It is essential to know what type of antigen and antibody are there in donor and recipient. At least 30 commonly occurring antigen have found on human RBC membrane: A, B, O, D, M, N, Kel, Dafil, Lewis and Lutheran. Antigen are genetically determined inherited factor known as agglutinogen. Why they are called agglutinogen? Because they call blood cell agglutination. In OAB system there are agglutinogen A and agglutinogen B. A and B antigen are inherited as Mendelian allelomorphs, and B are dominant. And in B they are inherited are B antigen from which they are parent, and B antigen from who is parent, and O from their other. In OAB system, agglutinin or antibody are anti-A agglutinin and anti-B agglutinin. If an agglutinogen is not present in the RBC membrane, anti-A agglutinin must be present in the plasma. Agglutinin or antibody develop in response to antigen enter the body in response to food, bacteria in other ways. At birth, quantity of agglutinin is almost zero and begin to develop at 2 to 8 months, reaches at peak to 8 to 10 years of age. What is the Blanc-Steiner law? If an agglutinogen is present in the surface of the RBC membrane, the corresponding agglutinin must be absent from the plasma of the blood. And second part is if the agglutinogen is absent on the RBC membrane, the corresponding agglutinin must be present in the plasma of that blood. So what is the major OAB system in the blood group? In OAB system, the blood group is A. In blood group A, the agglutinogen is A and agglutinin is anti-B or beta. In blood group B, agglutinogen is B and agglutinin is anti-A or alpha. And in blood group AB, agglutinogen is A and B and no agglutinin is present. And blood group O, no agglutinin is present in the RBC membrane, but agglutinin is NTA and NTB or alpha beta. What is the frequency of different blood group? The percentage of the blood group is, blood group O is 47%, blood group A is 41%, blood group B is 9%, and blood group AB is 33%. Only the 3%. Transfusion reaction by agglutination. What do you mean by agglutination? When blood are mismatched, blood agglutinin binds with the agglutinogen, that is antibody is binds with the antigen on the RBC membrane respectively. A single agglutinin can attach to two or more RBC or bound together cells clump, it is called the agglutination. Clumps plug small blood vessel, either physical distortion or phagocytic WBC destroy the RBC membrane, then hemolysis occur. In RS blood group, there are 6 common type of RS antigen, that is CDE, capital CDE or small CDE. D is more antigenic and prevalent. RS typing depend on the presence or absence of D antigen on the RBC membrane. In RS positive blood, if the RS antigen is present on the RBC membrane, it is called the RS positive blood. In RS negative blood, there is no RS antigen is present or RS antibody is present on the RBC, on the plasma of the blood. Unlike the OAB system, plasma agglutinin never develop spontaneously. Anti-RS agglutinin only develop if RS negative person is transfused with the blood containing antigen D, that is the RS positive blood. RS negative mother then carries the RS positive baby. So in RS system, RS positive blood contain the RS antigen, no RS antibody. In RS negative blood, there is no antigen or no antibody. What is the difference between the RS OAB system and RS system? In OAB system, development of agglutinin, it develops spontaneously. But in RS system, spontaneous agglutinin develop almost never occur. Instead, agglutinin develops on exposure to agglutinogen D. In OAB system, it follows the both part of the Landsteiner law, but in RS system does not follow the second part. What is the effect of maternal antibody on fetus? The effect of maternal antibody on fetus is the erythroblastosis fetalis, carnate tears and the liver failure. Now what do you mean by the erythroblastosis fetalis? Erythroblastosis fetalis, it is a disease of the fetus and newborn child which is characterized by presence of immature nucleated blood cell in circulation due to presence of progressive agglutination of the red blood cell. Incidence at first issue, it is not usually not occur. In second RS positive issue, the percentage is 3%, and third RS positive issue, it is 10%. How it is occur? The child is RS negative, mother, and child is RS negative, mother is RS negative, and father is RS positive. And at the time of delivery, fetal RS positive blood enters into the maternal circulation through the placenta. Development of NTD in the maternal circulation, so sensitization occur. Maternal blood with the NTD antibody enters into the fetal circulation through the placenta in case of second pregnancy. So NTD attacks fetal raised cell having antigen D and agglutination occurs in fetal blood. So hemolysis occurs in fetal circulation releasing hemoglobin D into the blood. So fetal macrophage convert the hemoglobin into bilirubin causing the fetus become jaundice and anemic. Hemopoietic tissue of infant attempts to replace the hemorrhaged red blood cell, liver and spleen enlarge. Because of rapid production of red cell, nucleated blood cell found in the circulation. So it is called the erythroblastosis fetalis. So this is my lecture on the blood transfusion. Assalamu alaikum. Thank you.